dentin hypersensitivity, it is characterized by sharp pain, sharp pain arising from exposed dentin in response to stimuli, typically thermal, evaporative, tactile, osmotic, or chemical, and which cannot be ascribed to any other form of dental defects or pathology. The main factors responsible for dentin hypersensitivity include loss of enamel, gingival recession, non-carrier cervical lesions which includes atresion, erosion, denudation of cementum thinning, fenestration, absent buccal alveolar bone, abrasion, effraction, periodontal disease, patient's habits. These are the factors that are most commonly associated with dentin hypersensitivity. And how will you explain the theory behind the hypersensitive dentin? Now look, the most common theory that explain the pathogenesis of hypersensitivity, the mechanism behind hypersensitivity includes that is known as hydrodynamic theory. And this hydrodynamic theory proposed by brainstorm, it is the most accepted explanation for dentin hypersensitivity. This theory explains that it states that external stimuli in the form of cold, heat, sugar, they cause fluid movements in exposed dentinal tubules. Now this is known as if you look this is the exposed form of dentinal tubule. This arrow shows the exposed, means enamel has been lost. So these tubules are exposed to your oral environment, and in oral environment, exposed to oral environment in the form of any stimuli, either any cold, hot, any osmotic stimuli, they will basically causes fluid movements. Now this is a dentinal tubule, and inside the bluish color indicates the dentinal tubule fluid. So any stimuli that increase the movements of this dentinal fluids, they causes fluid movements in exposed dentinal tubules. This movements of fluid will, what will it do? It will stimulate the nerve fibers. These are the nerve fibers that are surrounded by odontoblast, and these nerve fibers, when they are stimulated, they causes pain, resulting in sharp treatment pain. These fibers are known as baroreceptors. So when dentin is exposed like this, where gingival recession, enamel loss, dentin can be exposed due to any reason which are discussed above. So these open dentinal tube, what will it do? They connect the oral environment to the pulp. They connect the oral environment to the pulp. Stimuli causes the rapid fluid movements towards the or away from the pulp, triggering nerve damage, nerve discharge. So now in stimuli, cold, air, evaporation, dehydration, osmotic pressure, means solid force, they causes fluid to move outward while causing more pain than inward. So this is the theory that explains the basic pathogenesis of dentin hypersensitivity, most accepted theory. Now whenever you encountered a patient with complaint of dentin hypersensitive, you have to diagnose, you have to take thorough patient history, and clinical examination is mandatory. In history, what will you do? You will determine nature of sensitivity, dietary factors, enlist the dietary factors, inquire about his or her brushing technique. For dental history point of view, inquired about any periodontal treatment, mostly periodontal treatment, cementum and denudation is occurs that leads to sensitivity. So basic history, through history, rule out other causes of sensitivity like caries, felt restoration, tooth whitening, cracks. Now how will you confirm? Diagnosis confirmed by using a jet of air or by using a diagnostic probe on the dentin in mesiodistal direction in the area where the patient complains of pain. So this is the basic protocol of your diagnosis in case of a patient presented with complaint of sensitivity. How will you manage? The first step in the management of dentin hypersensitivity is removal of etiological factor. If you find any etiological factor during history taking in the form of improper brushing technique, in the form of poor oral hygiene, in the form of premature contact, you will just remove that etiological factor. If patient have habit of improper brushing technique, then you will recommend it, you will guide the patient for proper brushing technique. Educate the patient to avoid aggressive mechanical brushing. Prescribe patient to use single tufted brush. If you find any dietary factors in relation to dentin hypersensitivity, then you will advise patient to reduce excessive consumption of acidic food or drinks. Advise patient to use home sensitizing toothpaste. So if there is a particular patient, if you find any particular area associated with hypersensitivity, then educate the patient and demonstrate that area of precision. So these are the basic method to remove any etiological factors which are responsible for dentin hypersensitivity. The removal of following etiological factor can prevent dentin hypersensitivity from recurring: improper toothbrushing technique, poor oral hygiene, premature contact, gingival recession, and endogenous and exogenous acids. Second step is patient education. It is important to counsel the patient in order to modify their dietary habits. Efforts should be made to teach them a proper toothbrushing technique and achieve plaque control. I have already mentioned that. So after that, now move towards treatment strategies for dentin hypersensitivity. What will you do? So basic treatment strategies for dentin hypersensitivity can be categorized into 6 methods. Very first, desensitizing the nerves, in which you will prescribe any desensitizing toothpaste. Second, you have to occlude the dentinal tubules. Recent advances includes arginine, calcium sodium phosphosilicate. Second includes salts, and third includes protein precipitates in the form of CPACP and silver nitrate, glutaraldehyde. After that, zinc chloride. And then dentin adhesives. Use of dentin adhesives: you can use dentin bounding agents, composite, glass ionomer, and crown placement. In case of periodontal issues, you will go for periodontal grafting. And modern methods include lasers, use of ozone. So these are the basic methods. Now whenever you prescribe any desensitizer toothpaste in the form of potassium nitrate tooth containing toothpaste, or in the form of Colgate Pro Relief, so there is a criteria for selection of ideal desensitizers, which were outlined by Grossman in 1935. He indicated that the material or technique must not irritate the pulp excessively. It must be painless, it can be easily applied, and after that it may be permanently effective, act quickly, and doesn't produce any discoloration. These are the basic requirements of the any desensitizer which you will prescribe to patient. Now what it is show, this clinical picture basically shows the occlusion of dentinal tubules to minimize sensitivity through potassium salts, and here picture B is showing adhesive materials. They basically occludes the dentinal tubules, obliterate the dentinal tubules to prevent dentin hypersensitivity. Now we will discuss this the basic treatment of dentin hypersensitivity from research point of view, taken from Journal of Endodontics. And this article, they have compared role of ozone and laser in the treatment of dentin hypersensitivity, and the results of this study includes Both diode laser and ozone therapy significantly reduce dentin hypersensitivity, and they leads to immediate pain reduction, and pain reduction remained stable up to 6 months. No significant difference was found between ozone and lasers in long-term effectiveness. So what is the mechanism of action? If you are using laser for the treatment of dentin hypersensitivity, then what will be its basic mechanism of action? Diode lasers has been presented with different wavelengths and parameters to treat dentin hypersensitivity. You can use low power diode laser and high power diode lasers. Low power diode laser treatment has been used to create photobiomodulatory effects that reduce pain and inflammation, where high they block the mechanical tubules by melting dentin through thermal effects. So basic mechanisms of any laser, diode laser, in the terms of reducing dentin hypersensitivity includes: it causes protein coagulation, it leads to tubule occlusion, it may also reduce nerve transmission. How it block mechanical tubules by melting dentin through thermal effects. It can be used by either direct application involving irradiation of the affected area, or indirect by placing any agent like in the form of sodium chloride or stannous fluoride, then it will irradiate it to laser. Then ozone is a triatomic molecule incapable of keeping its chemical stability for longer time, because it's powerful oxidizing agent. For a long time it has been proposed in general dentistry for its antimicrobial, virucidal, disinfectant and biocompatible properties. It also has anti-inflammatory, analgesic, immunostimulant properties. It promotes tissue regeneration. Now it has been used in the treatment of dentin hypersensitivity. How it reduces dentin hypersensitivity? It promotes remineralization. It enhances tubular sealing. It has antimicrobial effects. So this was the summary of modern methods in terms of